Hello, welcome to another episode of Clean Health. My name is Dr. Oby Coucou, a West African trained cardiologist and a member of the Endocrine and Metabolic Society of Nigeria. Today, we'll be talking about diabetes, the silent killer. We'll explore the possible symptoms and signs of diabetes, as well as the complications of type 2 diabetes, both acute and chronic, and the role the family has to play in management of diabetes. Stay tuned as we come back.
Diabetes is on the rising trend. Millions of people die every day. It's a silent killer. So much glucose in the blood lead to insulin, leading to stroke, heart attack, kidney failure. On the diet, exercise, dose, monitoring. We've got to stop this trend. We've got to slow it down. Control diabetes, control diabetes, control diabetes, control diabetes. On the diet, exercise, dose, monitoring. We've got to stop this trend. We've got to slow it down. Control diabetes, control diabetes, control diabetes, control diabetes.
Welcome back. How do you know you have diabetes? Frequent urination, okay? What is referred to as polyuria. Increased tests, so frequent drinking of water, all right? Excessive weight loss, okay? Increased intake of food, excessive hunger and increased intake of food. Sometimes the person could have recurrent skin balls or skin infections, okay? And then they could also have wounds that are difficult to heal. So what actually happens is that when there is a high blood glucose level, it creates an osmotic environment that causes blood sugar, that causes water to move to the kidneys. So they would have this tendency to urinate frequently. So you see some patients present to us complaining, "Oh, doctor, I used to urinate 2 times in a day and then once at night. But of recent onset, I noticed that I urinate more frequently in the night, up to 4 to 5 times I wake up urinating. And I'm worried." Although there are other causes of excessive urination, like infections, urinary tract infections, okay, and other causes. But usually that's one of the commonest symptoms, all right? And then I tell you, okay, as you know, what happens actually is that as you urinate, okay, what the body does, the glucose, excess glucose or sugar in the blood will create an osmotic environment so that water is being drawn to the kidneys. Now, as you're losing water, there is a feedback mechanism that goes to stimulate some cells in the brain, some centers in the brain called the test centers. So the next thing, they feel thirsty. Test centers say, "Oh man, I'm thirsty. What's happening? I'm thirsty." So you see them drinking a whole lot of water. As they drink a lot of water, you find out that the person says, "Doctor, I tend to be hungry a whole lot." Because what happens, there's excess sugar in the blood, but the cells are starved of sugar. They're not getting the sugar because the insulin is not being taken into the cells to be used. And so there is what? There is starvation in the midst of plenty. So the cells are starved, they send signals to the brain, and then the person says, "I have to eat," and they keep eating, okay? And then because there's excess sugar in the blood, the cells are being starved, they're hungry for food. Without food, the body cannot perform. Without food, you cannot have energy. Without food, the brain cannot function. So what happens is that it will give signal to the liver to produce energy from other sources. So there will be generation of energy, breakdown of fats, breakdown of the fats that are stored in the body, in the fat cells. There will be breakdown of protein, okay, and so on to generate sugar. All right, so the person will begin to lose weight. All those fats that are stored in the fatty areas of the body begins to go off, okay? The person is despite the fact that he's eating, he'll be losing weight. So those are some of the symptoms that you would recognize and then present to your doctor. It's better to see a specialist who can manage it properly. Now, we'll go to what are the possible complications. The complications of diabetes are vast, okay? It can affect any organ in the body, ranging from the brain, okay, to the heart, to the kidneys, okay, to the blood vessels, to the nerves, to the foot, to the skin. So every organ in the body is affected, all right? And those complications can occur acutely, okay, that's in the short term, or chronically over a long period of time. You could have complications, all right? Now, if it affects the brain, the person can come down with stroke, all right? If you see a patient come to you, say, oh, doctor, I cannot move. I woke up suddenly early in the morning. I wanted to perform ablution or do some prayers or, have my bath or go to the toilet to ease myself. And I noticed that I couldn't move one half of my body, okay? So that is called stroke. If one half of the body cannot move, all right, as a result of a complication of diabetes. It can also cause memory loss. So people with diabetes have memory losses, what is called dementia. They can have Alzheimer's disease. So, but that's a big terminology, right? Let's take it down. You can also have problems with the heart. They can have heart attack. You know that what is heart attack? Sudden what? A person all of a sudden has severe chest pain that is so excruciating. You feel like dying, the worst kind of pain, squeezing in nature, you understand? That can, you cause the person to feel as if he's going to die, and comes in suddenly. So that is called heart attack, all right? I don't want to break it further down, but just to have an idea. They could have heart failure. What is heart failure? The heart can no longer pump blood adequately to supply food and nutrients to the organs on the body, right? So how does the person present? They'll tell you, oh, I have shortness of breath. I feel breathless when I walk a short distance. I feel breathless if I climb a stair. I have to stop because of breathlessness. They tell you that it has been progressing over some time, and recently, even at rest, they're breathless. Sometimes they tell you they cannot lie down flat on their beds. They have to wake up breathless. They will need to use 2 pillows.
Me I come to say this to you, boy. Rude boy. I say you stop the injustice. Burn them, daughter them. Why rape an innocent daughter? Come here to tell you this, boy. I eat a boxing. Babylon.
Why rape our girls?
Stop injustice, young.
Why rape innocent girls? Why rape our girls?
Injustice, yo.
Why rape innocent girls?
Tell you now.
Why rape our girls?
Babylon.
Why rape innocent girls? Why rape our girls?
Injustice, yo.
Why rape innocent girls?
Injustice, yo.
Cases of rape ranging from gang rape, child rape, serial rape, payback rape, war rape, rape by deception, bringing great physical, mental, emotional trauma. Oh, I rape, oh,
Me
again.
go turn down Babylon.
The story of a young lady who was gang raped, more than left to die naked on the streets. Oh,
Have mercy.
so much pain, so much sorrow.
Ashman.
Why our
That's the
girl?
all of Babylon.
Leading to a civilization, sense of social legal justice.
Babylon.
Victim blaming game.
Dash back. Me a go chant that Babylon.
There is a clearer call for change.
Me a go chant that Babylon.
Justice.
Me a go chant that
Justice. We
Babylon.
need justice. Educate, inform the people now.
Education in the real world, man.
Educate, inform the government.
I need the right and why, man. Chant it, sister.
Educate, inform religious leaders.
Big up.
Eradicate this intolerable social
Me a go chant that
injustice.
Babylon.
We need justice, 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 justice.
Justice worldwide. Chant it.
Oh, why rape again?
Let mercy.
Why rape innocent
Let
girl?
mercy.
Why rape our girl?
I'm here to tell you this why.
Why rape innocent girl? Justice, justice,
Justice.
justice,
Justice.
justice, 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 clean health, healthy living, illness prevention, and health awareness with Dr. Oby Coucou.
Hello, everyone. It's good to have you join us in yet another episode of Clean Health. My name is Dr. Oby Coucou, a consultant cardiologist and a fellow of the West African College of Physicians. I'm excited to have with me in the studio today a special guest in the person of.
Farouk Nanabello.
You're welcome, Mr. Farouk.
Thank
Can
you.
Can you let us know who you are?
Well, Farouk Nanabello is a practicing journalist, a development practitioner, and also a public analyst. And it will interest you to know that I am very much interested in health communication.
Beautiful. I like that. So, today we'll be focusing on a very important topic known as hypertension. Stay tuned as we come right back.
Clean health, healthy living, illness prevention, and health awareness with Dr. Oby Coucou.
Welcome back. Mr. Nano Bello, you're very welcome once again.
Thank you, Doctor. It's indeed a pleasure to be a part of this program today.
Beautiful. So you would guide us in the direction of the show or the program today regarding hypertension and ask any questions or concerns you might have regarding hypertension. So over to you.
Well, I would like to first of all thank you for inviting me to this important program. And thank you, viewers out there. It's a pleasure to be a part of this program today. And of course, given the topic of discussion, hypertension, which I believe is one of the global pandemics facing the societies today.
Yeah.
And of concern is the fact that it has been ignored for far too long.
Yeah.
Ignored in the sense that a lot of problems, have happened as a result of the fact that people do not have much knowledge around the issue of hypertension. Some people work in the streets without knowing that they even have this problem, perhaps because of the lack of awareness, and knowledge concerning the issue of hypertension.
Yeah.
So I think it's an opportunity for the viewers out there to get to know more about hypertension and all the issues around it. So it's an honor, actually. Let me first of all ask, Doctor, you're the expert here.
Yeah. Thank you.
What is this hypertension? Because perhaps it has other things beyond what we think of.
Okay.
People just think hypertension has to do with just people overthinking.
Right.
So, what's this hypertension?
Beautiful question. So hypertension can be defined as a persistent, sustained, raised blood pressure greater than or equal to 140/90 millimeter mercury, with a recent redefinition of the threshold at 130/80 millimeter mercury, or the current use of antihypertensive therapy. In other words, the blood pressure of every human should be less than 120/80 millimeter mercury. However, when the blood pressure is high, it is regarded as hypertension. Now, the heart is able to contract and pump blood through the blood vessels to all the systems and organs in the body. During that contraction, you have the upper blood pressure, and that is referred to as the systolic blood pressure. When the heart relaxes, blood fills into the heart. During that relaxation period, you have the diastolic blood pressure, which is the lower blood pressure. This is usually determined with a sphic, or a blood pressure measuring machine, of which we have one right here.
Okay, doctor, not to cut you too early. If I'm concerned, you mentioned high blood pressure and low blood pressure. That means there's a sort of a distinction here between the two, definitely. But before we go there, you mentioned 120/90.
Over 80, sorry.
Over 80.
Yes, normal.
That's normal.
Yeah.
Okay, so now perhaps from 120/90 or 140/90, there's a problem.
Yeah.
But the question here is, do we assume that whoever walks into a facility and for the first time is measured to have, gotten to the blood pressure raises from, the normal to maybe 140/90, do we say the person is hypertensive?
Good question. Now, if a person comes to the clinic, for instance, and the blood pressure was incidentally determined and was noted to be high, perhaps let's say 140/90, for the first time, and you as a clinician, you've taken a history from the patient and discovered that he has no family of history of hypertension, and this is the first time he's ever been hypertensive in his life, all right? You don't go out to say, and you've clinically examined him, and he has no evidence on examination that he has a long-standing hypertensive heart disease. You don't go outright to say he's hypertensive. What you then do is to give him a 2 weeks period for which he goes home and then monitors his blood pressure on a daily basis. He can use the automated or the digital blood pressure measuring machine at home to check his blood pressure on a daily basis and record it on a chart, so that when he's coming back to the clinic in 2 weeks' time, you also check the blood pressure and compare and know whether it's persistently, remember I said in the definition, when it's persistently sustained, raised blood pressure, okay? Remember, there are stressors. Things can raise blood pressure, okay? If for instance, there's what is called white coat hypertension. When you come into the clinic and see a doctor wearing a white coat, you're scared.
So that alone triggers...
Yeah, some hormones are released and you're like, the BP can go up because you're scared. Or in the clinic environment, there are a lot of patients, especially in Nigeria. So there's overcrowding, people are hustling for their folders, there's a lot of pandemonium within the clinic environment. It's not so organized. So it tends to raise the pressure of people. Again, stressors like maybe anxiety, emotional stresses, anger, excitement, And sometimes if you have a full bladder or you're in pain, the blood pressure can rise, okay? So in such an instance, you need to recheck the blood pressure in 2 weeks. If the blood pressure is persistently greater than 130/80, it's likely the patient is hypertensive, okay? If it's greater than 140/90, then you know that he has a severe hypertension by the recent definition.
Okay. Now, how then should one check this hypertension apart from the other way you mentioned by way of using, the measuring device?
Yes, the measuring device. The only way we check the blood pressure is using the blood pressure measuring machine.
Okay.
Okay, and this is known as a sphygmomanometer, or a blood pressure measuring instrument by layman.
Can a common man use this?
This is used by a doctor or a
Okay.
specialist, someone who is trained in its use.
Perhaps there's
Yes,
another one I
because-
can use personally in
Yes,
my home.
there is an automated or a digital one,
Okay.
which is programmed. You just tie the cuff. You should have an adequate cuff size
Okay.
that you tie, okay, and then use it to check the blood pressure at home and use to monitor. But it's not as reliable as this particular Sphig. So,
Okay.
whenever you want to check the blood pressure, you must make sure that the patient is well rested.
Okay.
For instance, if he comes to the clinic, you should sit down for about 5 minutes to rest, okay?
Okay.
So that you relieve all form of anxiety. Okay, 30 minutes prior to the blood pressure check, you should ensure that he's not taking any coffee, because coffee can raise the blood pressure.
Okay.
You should ensure that he's not done no aerobic exercise in any form 30 minutes prior
Okay.
to your measurement, and then you should ensure that the patient is calm, right?
Okay. Okay.
All right.
Yeah.
No food eaten 30
So
minutes
even if
prior
you're
to.
doing this in your home, you must make sure that you are in a relaxed
in
manner.
a relaxed manner.
Okay.
Okay. Once you're relaxed, okay, then you have a blood pressure cuff size, okay, and there are different sizes.
Okay.
So the cuff must be adequate for the arm. Some people are fat, some people are thin.
No, okay.
So you have to have the adequate size for the individual.
And you
Because
must tie this
yes,
very
you,
tightly.
You tie it, okay,
Okay.
around the arm. You can give some space between the arm and the
Oh, okay.
wrist joint and above. Okay.
Okay.
All right. And then, of course, the doctor will use a stethoscope and then check the blood pressure. I
Even
don't
though I
have
always-
to go into the details
Yeah,
of that.
definitely,
But the
because-
automatic one, once you tie it,
Mm.
you click on, there's a button you click on, it starts giving you the recording. So it will give you the upper pressure and the lower pressure, and then, that's how. But usually, you should check the blood pressure in both arms,
Okay.
as long as it's the first time you're checking the blood pressure. Because sometimes you could check the blood pressure on one arm
Okay.
and it's lower than the other arm.
That's
There's certain,
another complication.
there's certain conditions that can give you that, which I don't want to mention here because the layman will not
So if
understand.
I get you, even if somebody is to consistently,
no, for
check
the first
himself.
time, sorry, for the first time, not
Yeah.
consistent, not every day. So
Now,
for
I
the
mean, in
first
the
time.
case of a candidate whom you are trying to establish whether or not he is or she is hypertensive,
Yeah.
you said you're going to recommend that the candidate should do the check regularly for a
Yes.
time period.
Yeah.
So what I'm saying is, if one must do that, is it okay if he visits the hospital daily to get,
Sure.
the check?
Yes. If he cannot do it at home with the digital,
Okay.
he can visit a nearby clinic
Okay.
where a nurse or a specialist can check for
Okay.
him and then give him the records,
And then,
which you record on a daily basis.
okay.
Sometimes you can do a 24-hour monitoring of the blood pressure.
Okay.
Isn't it? You just apply the instrument every 30 minutes. It gives you the reading,
Okay.
and then at the end of the day, throughout the day, you can check the blood pressure because the blood pressure changes throughout the day. Sometimes it will go normal or
Okay.
low, and then towards in night or midnight, 12 midnight
Yeah.
or so, there's a surge in hormones, so blood pressure goes very high. That's why
Yeah.
you see some people have strokes early hours of the morning.
That's right.
Yes,
It's
so,
always the case.
yes. So it
Now,
can give you an idea.
Then let's go into who is actually affected, because there's this concern that even younger people, come down with, high blood pressure. So who is really affected by this?
Yes, thank you very much,
Yeah.
Mr. Nanobali. Now, a whole lot of people are affected, okay? And hypertension, there is a rise in prevalence all over
Okay.
the world. About 1.13 billion adults are affected all over the world.
Yeah.
And even in Africa, there's a rising prevalence. The low middle income countries are more affected. About 2/3 of people are more affected by hypertension. In Nigeria, about 57 million adults or more than are
Okay.
living with hypertension. And about a third of them are aware. 2/3 are not even aware. And
Yeah.
of the third of them that are aware, only 2/3 of them are on medications. And you find out that a lot of people are not consistent on their medications. Okay?
Yeah.
So it's a global problem. and is a problem in Nigeria and Africa, okay, because of the westernization of Nigerian Africans. We have adopted Western lifestyle.
You know,
Yes.
talking about westernization, I became concerned. You also
Yes.
mentioned the issue of poverty.
Yes.
Because you say low income.
Yeah.
Low income, as far as I'm concerned, has to do with poverty.
Yes.
And so I am concerned as to, okay, why is poverty having any relationship with hypertension?
Yes.
Is it because of the food we consume, or the kind of lifestyle we live, or the fact that we are not in, I don't know.
Yeah, sure.
Please
Good
share with us.
question. It has to do with the lifestyle, you know.
Okay.
The lifestyle of the people. Okay, we're adopting the Western lifestyle. You know, for instance, if you look at diet, a lot of people eat more of processed food,
Yeah.
canned food, you know.
That's right.
A lot of people do junk food. We live a fast life, so we don't have time to prepare homemade food. Remember, in
Okay.
those days, our parents, when they prepare food at home, they go
Yeah.
to the backyard, they pick bitter leaf.
They are very nutritious.
Yes, very nutritious
Yeah.
meals that help the body. But right now, we eat a lot of food. We take a lot of soft drinks, sugary drinks, you
Yeah.
know, sport drinks. You know,
Regularly.
we take a lot of salt in food. Okay, salt in diet,
Yeah.
and then we have less of exercise or physical activity because of advancement in technology. You
That's
know, we're
right.
advancing in technology, isn't it? So we have a lot of computer systems. You know, a lot of people spend more time
Yeah.
sitting and watching those things. So
In
those,
one
those
position,
in one
certainly.
position. So we
Yeah.
have less of physical activity. You know, all these things predisposed. That's why I talked about westernization.
Yeah.
So and then again, the urban people in Africa or in the
Yeah.
low middle income countries, you find out that urban people are more affected than the people in the rural area.
Yeah, because to a large extent they
Yeah,
still
because
subscribe to some of these kind of foods we eat in the rural communities.
Yeah.
Now, let's
Clean health, healthy living, illness prevention, and health awareness with Dr. Oby Coucou. Thanks so much for watching my videos. Thanks for liking. If you like them, lay your comments in the comment section. If you have any health issues, please do ask your questions in the comment section and I'll respond to you. I'm so happy. I'm so happy. God has been so good to me. God has been so good to me. No one like him. No one like you. No one like you. Do subscribe to my YouTube channel, everyone. I know you're following me and you're liking my videos. I'm going to teach you. There's a whole lot I'm going to teach you. There's a whole lot to give you. I just need you to follow me. Just keep following me, okay? You are wonderful people. You are special people. God has made you great. No devil can stop you now. You're going to achieve what God has destined for you. Thank you, thank you, thank you, thank you, thank you now. I'm so happy today, for God has provided all my needs according to his riches and glory. Don't mind me, I'm always being very natural, okay? Thanks for following me. Thanks for subscribing to my YouTube channel. This is Dr. Oby Coucou, a consultant cardiologist and a fellow of the West African College of Physicians. Okay? I really appreciate you all. Okay? Thank you so much. Ooh. Yeah. Ooh. Yeah. Ooh. Yeah. Oh, yeah. You want to praise God, yeah. You want to praise God, yeah. No one can be like you. Yeah, 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 yeah. Oh, yeah, boy, yeah, boy, yeah, boy, yeah, boy. Praise his name. Praise his name. Hello, everyone. My name is Dr. Oby Coucou, your favorite doctor. I'm here to talk about a very important public health issue known as impotence, or what we refer to as erectile dysfunction. It's a major global issue, and a lot of men are affected with this condition. I'll state that it's an inability to obtain and maintain a penile erection that is firm enough to sustain satisfactory sexual intercourse. And that's what impotence is, okay? It's an ongoing problem. It affects the confidence levels of men, their ego, it increases stress levels and affects relationships. And a lot of men are embarrassed to talk about it. They suffer in silence because of the stigma associated with it. And they do not want to talk about it, and the problem keeps going on. But the interesting thing about it is that it's largely preventable. Even if you get it early, it's reversible, okay? And there are treatments for it. There are several options and treatments for it. So why shy away from talking about it? Why shy away from discussing with your clinician when you observe this problem? So it's a cause for alarm. Once occasionally you can have erectile dysfunction under stressful conditions. Okay, for instance, if you go into a forest and you see a lion, the first thing that you do is your eyes pop out. You're scared. Your heart begins to beat very fast. Why? Because there are some hormones that release, like adrenaline. Okay, which is the fight flight hormone, and so you want to run away. It gives you energy to run away from that lion. At that point you think your penis will go up. No, it's going to drop. Blood flow will not go to that area at all. Blood will pump to other areas that will give you energy to run away from that lion. And so that's likened to stressful conditions. So occasionally men will observe that. Shouldn't be a thing of worry when you see it occasionally, but when you see it persistent, coming up more frequently, you should be worried because it's an underlying or habinga. It's a habinga of an underlying cardiovascular disease or heart disease, and which will require early referral to your cardiologist, a doctor that is trained in managing heart conditions, or your urologist, a doctor that is trained in managing issues regarding the male organ, or any other specialties, because it's a multidisciplinary management of patients or people that have this condition. All right. We know that there are types of. Also, before I go further to talk about the types of erection, I want to let you know that over 50% of men greater than 40 years have this issue. And some young men, about a fifth of men greater than 20 years have this issue. And in the young men, they feel, oh, well, it will overcome it, while the older men feel, okay, is a normal aging process, but you need to listen to me carefully so that you can really get to the nitty-gritty of what this is all about. Now, for you to have erection, there are types of erection. We have the psychogenic erection. Psychogenic erection has to do with your sexual thoughts, right? If a man sees a woman who is sexually appealing, passing by, he would have some sexual thoughts that goes to the brain, and I'm like, I want to have something to do with this woman, isn't it? So that is a sexual kind of arousal, okay? Psychogenic. There's a reflexogenic
reflexogenic type of erection. Here, this has to do with tactile stimulus or touch. So if a man is touched in certain areas, for instance, his spinal area, his thighs, or the nipples, and so on, he'll have some form of erection, isn't it? And then there's also what is known as a nocturnal erection. A nocturnal erection occurs at night, what we call the rapid eye movement sleep erection. The layman refers to it as maybe having wet dreams, having dreams at night, and then in the morning you see some sperm, on the bed. It's a normal finding you see, especially in adolescent young men as they grow older, So these are some of the types of erection. And erection can also be from talks. Okay, there's some erotic talks that stimulate men. A woman does erotic talks to stimulate the man, isn't it? So whatever the form of stimulation, there is the process of erection is a complex interplay of the brain, okay, the blood vessels, the nerves, the anatomy, the penile anatomy, the penis itself. The penis has, of course, two major muscles surrounding the pathway through which the sperm passes through. So all these interplay. So if there's any problem in any of these, the brain or the hormones that are released or the blood vessels, the penis itself, the anatomy of the penis, if there's any problem in any of those pathways, you can have problems with erection, right? So for you to have an erection, okay, there is a stimulus that goes to some center in the brain that will cause the release of some hormones known as nitric oxide. Nitric oxide is a potent vasodilator, so it dilates the opens of the blood vessels and increases blood flow to the penis. Okay, so when it does that, there's an increased blood flow, a gush to the penis. You need enough blood flow to the penis for you to obtain an erection and to even maintain that erection. Now, for you to, during exercise, you need about 5 times for 5-fold increase in blood flow, okay, to the heart. But can you imagine how much blood flow you need to obtain an erection, or to even maintain the erection? You need about 100-fold. That's a whole lot. So that flow goes in there, and the pressure of the flow, of course, will into the arteries around the penis, okay, will occlude or close or compress on the veins. Okay, there are arteries and there are veins. The arteries take blood to an area, the veins take blood away. So to occlude the veins and prevent the veins from carrying the blood away, so that the penis will not move from hard to soft. So for you to move from soft to hard, you need enough blood flow to that area. Okay, so when the blood goes there, of course there are nerves that are also involved, and then that will enhance the erection and also enhance the ejaculation. Okay, all right. So this is what occurs. So moving a penis from a soft to a hard penis, you need maximum blood flow, isn't it? So anything that will interfere with that process will give you erectile dysfunction. So there are several causes. So we talked about the brain. So there are psychosocial causes or psychological causes. Psychological causes, one of the commonest causes. You see people that have relationship issues. If a husband and a wife are quarreling, for God's sake, there's no way you would have the interest or the stimulation will go. It won't go. And then, of course, if you have some form of depression, depression has to do with you don't have interest in life. You have in life activities. You are sad. Some people want to commit suicide. So can have problems with erection. They won't have interest in having any form of erection. Okay, there's what is known as performance anxiety, and that's what I talk about when you see a lion, you want to run. There's a story of a lady who had problems with infertility. So they were married for 10 years and they had no issue. And apparently the lady did not know her menstrual cycle. She did not know which was the safe period and what was which time of the cycle is good for taking in. So for 10 years she had been living with her husband and having sex with her husband during the safe period. Okay, Now, we know that every woman has a 28-day cycle, and on the 14th day is the ovulation period. So 3 days before the 14th day, okay, or 3 days after the 14th day is the period that you can take in. Some people's cycles are longer than 28 days, some are smaller, but 14 day, 3 days before and 3 days after is the period you can take in. So when she presented to her gynecologist and complained with her husband, no, she complained actually. The husband refused to follow her, and then he told her, okay, this is the problem. How many times you have sexual intercourse with your husband? At least a good couple should have sexual intercourse like 2 to 3 times in a week, which has been shown from studies to even improve the heart health. Okay, so she told the doctor, and he now told her, okay, you know your cycle, how is your cycle, and all that. By the time they were done, she found out that she had a problem of not knowing her cycle, and so he advised her on what to do. She now came home and walked towards that. She checked her cycle, and then one day she came to her husband and said, my darling, today is my ovulation period. Today is my ovulation day. The doctor says that we're going to meet on this day, and if we meet on this day, we will have issue, we'll have a baby, right? And most like a boy if it's on that ovulation day. So the man, he said, she said, yeah, let's do, we must have baby. And next thing, the man was like, he wanted to perform, but he couldn't obtain an erection. You see, that's performance anxiety. He was anxious. How will he perform? Will he, anxiety of having a baby after 10 years? Can he be able to deliver and all that? And he didn't have an erection. So women, be careful. You don't divulge such like that. You go about it automatically. So stress, also anxiety, stress, then psychological disorders like what we call post-traumatic stress disorder. There are people that have maybe a traumatic experience in life, for instance, rape, a rape experience, they might have problems with erection. Okay, there are medical conditions that can cause erectile dysfunction, for instance, diabetes, hypertension, obesity. Okay, what happens in diabetes and hypertension is that there's blood vessel lining injury, which will stimulate a cascade of reactions that will cause thickening of the blood vessel. Okay, so the blood vessel thickens, they become stiff, they become narrow. So if there's anything that will reduce the caliber of your blood vessel, there'll be reduction in flow of blood to that area, isn't it? So diabetes can do that, hypertension can do that. Also diabetes, the blood sugar, they like to bind to proteins. Okay, they like to bind to the proteins, the Schwann cells across the nerves. Okay, if it binds to it, it will block conduction of the nerves, and then of course the nerve cannot deliver electrical impulse, and then of course this, I told you, nerves are involved in the process, isn't it? So people that have liver disease, kidney failure, kidney disease, a high level of cholesterol, okay, if you have high fat levels, it can give you erectile dysfunction. Okay, people who have prostate cancers, okay, have erectile dysfunction, or BPH. You know what BPH? Benign prostatic hyperplasia, where the prostate is enlarged, usually occur with aging in men. It does not cause erectile dysfunction, but however, the drugs used to treat it can give you erectile dysfunction, isn't it? All right. So there are other causes of erectile dysfunction, such as drugs. There are certain drugs you take that can cause erectile dysfunction. The hypertensive patients that take some antihypertensive drugs, they can give you erectile dysfunction. Not all antihypertensives can give you erectile dysfunction, but this should not make you stop taking your BP drugs, please. You have to weigh the risk-benefit ratio. What is the benefit of me controlling my blood pressure? And what is the risk, okay, of not controlling it? You understand? So you must take your medications if you are hypertensive, please. Okay. I had a patient who came to me in the clinic one day. He complained that, doctor, I have problem with the other room. That's the other room, when my wife is complaining, I cannot satisfy her. I said, what's the problem? He said, yes, even if he has an erection, when he wants to penetrate the wife, the thing goes down, falls flat. And I'm like, oh, wow. So, okay, let's check your blood pressure. We checked his blood pressure. It was 180 over 120. And he was like, doctor, please, this BP, but my major problem now is this erection. I want you to help me so it will be solved. Right? That's my problem. So I now had to counsel him that it's multifactorial. Some of these causes I'm telling you, I told him, and that we can manage it, but let's first control his blood pressure, because hypertension is one of common causes. Let's control your blood pressure, okay? Then we can now look for other means that medications I can give you. But the guy was like, BP is not his problem. Problem is that other room. He has to perform. You see, so the male ego is very important. They don't joke with that area. So I had to cancel him. Then we took time over a range of period. We were able to control the blood pressure. And then, of course, I gave him some exercises to do and some other therapies. And he started getting better. I also referred him to a urologist who took care of that. So it's important, drugs, okay? But you must take your medications to control your blood pressure. There are also other drugs, people who have psychiatric problems, depression I talked about, or psychiatric issues who are on medication can have this problem. Then also tobacco, people who smoke and take alcohol. You smoke, you take alcohol, it's going to give you erectile dysfunction over time. Please stop smoking, stop taking alcohol, okay? There's also those that do chronic bicycle riding. You ride bicycle a whole lot for a long time. It's not good for men. Please stop it. Then also people who watch pornography and do a lot of masturbation practice. Masturbation is not good for your male function. Over time, it will give you erectile dysfunction. Please stop it, okay, if you're doing all that. There are also surgical causes, okay? People who have had surgeries for prostate cancers or radiation therapy, what we call radiation, they put some rays to burn up the cancer cells, and they can have erectile dysfunction, okay? And there are endocrine causes. People who have low male hormone. If the male hormone is low, what we call hypogonadism. Male hormone is low. Have you seen some men that look like women? Yes, they have a structure that looks like a feminine structure. You can have erectile dysfunction. I forgot to talk about obesity. You've seen men that have big tummy, pot belly. There's a friend of mine in those days. There's a man that came to marry her. He was like 35 years. So he came with pot belly. He had this pot belly at 35 years, for God's sake. And then he was desperately in love with her. He wanted to marry her. He kept disturbing. It was all over her. But you know what she told me? Say, hey, Oby, I cannot marry this man. His tummy is so big. He has a big tummy. How will he perform in the other room? It was the other room. How will he perform in the other room? So she was really worried. And that was actually how she ran away from him. She didn't have anything to do with him. Now, men, if you have pot belly, you need to do tummy sit-ups every day so that you can reduce that belly fat, apart from the fact that it can cause you diabetes and cause you other diseases and heart diseases. Please, it can also affect your erection. Remember, your ego is most important. Your pride, you must sustain it. You must preserve it, okay? So the other thyroid diseases can also cause erectile dysfunction. Problems with the thyroid. The thyroid gland is located around here. If it's enlarged or you have excessive production of hormones or maybe reduction in production, it can affect the erection, okay? Also, sexually transmitted diseases, infections, okay? Gonorrhea, chlamydia, HIV that is not treated well or is not being treated. Hepatitis, viral hepatitis can cause inflammation of the prostate. Anything that will inflame the prostate can affect your erection. I was talking about good men. If you see you're having discharge, penile discharge, you see discharge from your penis, or you see some changes around your organ, you are shying away, you don't see your doctor, please go and see your doctor so that you don't have erectile dysfunction. So I think I'll stop here for today. Okay, we've talked about the prevalence of erectile dysfunction globally in Africa, in Nigeria, and we've also looked at the factors that are responsible for you to obtain and sustain an erection. And we also talked about possible causes of erectile dysfunction. The next talk, I'm going to talk about what are the possible treatment options, okay? And subsequently, I'll talk about the natural foods that males can take to improve their sexual function. I hope you've gotten one or two things from this talk. It's meant to educate you. It's free of charge, okay? So I will lead you to subscribe to my YouTube channel at Dr. Oby Coucou, and share my videos whenever you come across them, so that people will get enlightened, okay? Do these things free so that you can be better educated for your health. So please help me share the videos, help me subscribe to my YouTube channel, and follow me on Facebook, my Facebook page at Dr. Oby Coucou. Thanks so much for watching. Do have a great day and keep your male organ intact. Have a great day.
Hello, welcome to another episode of Clean Health. My name is Dr. Oby Coucou, a West African trained cardiologist and a member of the Endocrine and Metabolic Society of Nigeria. Today is a special day when we're looking at the prevention and control of diabetes. As you can see, the table is full so that you could get to the nitty-gritty of what to eat and how to take good care of your health. Now, we talked about the risk factors for type 2 diabetes, and we mentioned obesity, okay? Excessive weight. So if you're overweight, you need to lose weight, okay? And what does that mean? You need to do exercise at least 3 times in a week, lasting for 30 minutes, or sometimes 5 times in a week, as recommended by the World Health Organization. All right? Now, again, you could engage in what? More of standing than sitting, okay? We've talked about sitting can predispose to diabetes. So the more we stand, the less we're at risk of type 2 diabetes. Again, to control or prevent and control diabetes, early diagnosis is key, okay? Early diagnosis, early recognition of symptoms, as we mentioned in the previous episode, and then early recognition of the risk factors, okay? Identifying that you have this problem and quickly reporting yourself to see a specialist. You need to see a specialist, someone who is trained in handling such cases so that you don't have any complications and you can be managed early, okay? It's important also that you monitor your blood glucose levels. So you should buy a glucometer at home and check your blood glucose levels and monitor them. Have a blood glucose chart or a booklet where you record your glucose every morning. You record the date, the time, and then what is your level for the day. Both fasting, that's when you have not eat, you wake up, when you ate last in the night, and then you woke up first thing in the morning, you check your sugar levels before you eat, and 2 hours after eating, you check it again. So these are very important to monitor your blood glucose. And also, take your medications. If your doctor prescribes drugs for you, don't shy away from taking your medications. You need to know you have to be on drugs for life. You have to be on your medications. If you need insulin, maybe if you have an infection or you need insulin at any time, do not shy away from it. Do not be afraid. Forget about the myths and the confusions you hear in the environment. Listen to your specialist. Take your medications and be serious about them, okay? Then again, another thing that is very important, which we're going to talk about today, is the nutrition. What is your diet like? You are what you eat, okay? So it's important that you take into cognizance the kind of food you eat. It's expected that a diabetic patient, he eats healthy diet, just like every normal human being. So these myths that go around saying, oh, you don't eat this, you don't eat that, you don't eat this, and so you become frustrated, you don't know what to eat anymore. It does not sell anymore. The current trend entails that you eat a balanced diet containing carbohydrate, protein, minerals, vitamins, water, and what? Fats and oil. So what is expected of a diabetic patient? You're expected to eat, there are foods you avoid totally, you don't take at all. There are foods you eat in moderation, and there are foods you are permitted to eat as much as you like. For instance, you are permitted to eat fruits and vegetables as much as you like. Vegetables, we have cabbage, we have carrots, we have cucumber, we have so many kinds of vegetables, peas, all right? So you can eat it in your salad, all right? So for instance, this is a plate of food, all right? You apportion the food. We talk about the proportion of food. The quantity of food you eat is what's emphasized on. So you should reduce the quantity of food you eat, okay? And you can permit it to eat any good food that is healthy. So for instance now, this is a plate. I divide this plate into 3 portions. This way, halfway, which one side will contain all the vegetables, and on this other side we divide it into two, so into three parts. So this part contains your rice and beans, which is here, and then this part contains your lean meat. So this rice and beans, you have your carbohydrates, okay? And it's good to take more of complex carbohydrates, okay? What do I mean by complex carbohydrate? Carbohydrate that is not easily digestible by the small intestine. It goes to the colon straight. So those carbohydrates are not absorbed fast into the body. For instance, look at this food. This, you know about ofada rice. There's a rice called ofada rice. It's a kind of local rice where the back of the rice is not removed. It's very important that back is very important because it contains micronutrients. It contains micronutrients, vitamins, and minerals that are very important for your health. So it's very good you don't remove the back of certain grains, okay? So whole grains are important. Your chicken, your lean meat. Now for the chicken, for instance, in this plate of food we have chicken. You need to remove the back of your chicken. Do not eat the back. The back contains a whole lot of cholesterol. So you remove the back when you want to eat. It's not necessary that you eat the back. It's not good for your health. All right? So that's that. So this is a kind of example, an example of an apportioning of a plate or meal for a diabetic patient. You have carbohydrate, you have protein, you have vegetables, minerals, fats, and there's fat and oil which is used to prepare this. Okay, so the oil that you're using to prepare your meals should be what? Good oil, not the saturated oil. Now, what do I mean by good oil? Olive oil. So, balanced diets, we said foods to eat liberally. Fruits and vegetables. You have a portion of fruits here. So you can make your fruit salad. Now, it's not good to eat all of them at the same time because it will be a large meal. So you are permitted to eat in between meals. You can take more frequent meals in smaller portions so that the body can be able to handle the glucose load. Okay, we don't want you to put a lot of glucose into your system. All right, so if you eat this meal, for instance, for instance, you make your breakfast, all right? And your breakfast, maybe you'd want to take oatmeal, for instance, Quaker oat or oatmeal. Of course, it contains the back, which is very good. It's a high complex carbohydrate. It makes you get full easily. It makes you easily satiable. It makes you also, it reduces digestion and absorption of glucose. So the glucose load is lower when you take an oatmeal. So, or you can take Tom Brown for breakfast. Tom Brown contains, for instance, soya beans. It contains maize, guinea corn. It contains some groundnuts. And then this one contains Debino dates, which is also very good, and coconut natural flavor. It does not contain sugar. So this is it's a Tom Brown. It's called Tom Brown. The components are very important. So you need to look at your food labels and determine what is the caloric content of this food label. What is the content? That will be for another day. But this today, you just want to mention the kind of foods you can eat. Okay. So for breakfast, you can have Tom Brown. Okay. You can have a piece of bread. Okay. We talk of whole wheat or whole grains. Okay. Whole grains are the kind of foods you should eat, complex carbohydrates. So you can take your bread, just a slice or two slices of bread. You can make club sandwich. You can get your lettuce, your tomato, fresh tomato, okay, for breakfast. Don't eat bread like that, okay? Take it with some vegetables. Vegetables enhance insulin activity. This is a hormone. Enhances its activity and helps it to perform better. So please, put your vegetables between your bread. Okay? Then, for breakfast, you can have another thing, what is called granola. This is granola. It's a composition of cashew nuts, okay, walnuts. You have pumpkin seeds, almond seeds, coconut flakes, dried fruits. It has sunflower seeds. It has Pikachu seeds, which is very good for health. Okay, there are some of them that contain sugar. Don't go for those ones. Make sure you can even buy the ingredients and make it for yourself. Make it consistent. It's very nice. If you take it with Greek yogurt is one that doesn't have saturated fat. Okay, it doesn't have sugar in it. It's very good. It gives you a feeling you're full. You can carry along for the day. You won't feel hungry. Okay, and it can help you even lose weight. All right, so those are good breakfast meals. Even your egg, you can sometimes do. Maybe today I want to do oatmeal and egg. Just like that. At least you have protein, carbohydrate, and that. Now, we said foods to eat as much as possible your fruits and vegetables, okay? And then proportion, reduce the proportion, take it in between meals, right? So you have your apples too, you have your mango. You don't just carry a whole mango like this and put it into your tummy. It's a whole lot for you. You can just take a slice, okay, and take it in between meal. The same thing, just one apple in between meal is okay for you. You have one guava in between meal is okay, so that you help insulin to be produced and act. You have pineapple, just a little portion is good for you, as well as watermelon, a little portion. So some people will take they say, oh, the doctor said I can't eat fruits as I like. Oh, carry this whole watermelon. Sit down and start eating the whole thing. Please, I didn't say so. You just cut it and take a little portion. And you eat in between meal, not with your meal, because it will be excess glucose load. Do you understand? Now, again, we said foods that we can eat, we should avoid completely as a diabetic. You must avoid junk food. Don't eat junk food. Don't eat refined sugars. What do I mean by refined sugars? Anything that is sugary, that you put into your mouth that is absorbed fast into your blood, is not good for your health. It will raise your blood glucose level very high. So avoid added sugar. You say, you want to make tea in the morning. You carry sugar and put in your tea. It is not good for you. Avoid chocolates, ice cream. I know you like ice cream. You say, man, oh boy. It's just once in a while maybe. And then by then, of course, you should have a glucometer to monitor and know if you are abroad, they have a way of giving the insulin with insulin pump, and they can be able to monitor and give the insulin appropriately when they increase their caloric intake. But here in Africa, we don't have, such facilities or such pleasures. So please, if you want to take don't take your ice creams and chocolates and all that on a daily basis. Just once in a while, maybe you want to catch some fun, But